The Health Funders Association has raised constitutional and economic concerns about the National Health Insurance Act. The association is bringing a legal challenge against the act, saying the proposed model shows working class, mostly black and coloured medical scheme members will be disproportionately affected. The body has also highlighted that a 115% increase in income tax or a 36% rise in value-added tax would be required to fund NHI. HFA CEO Thoneshan Naidoo discusses this with us. Thank you so much for your time. Do talk us through the legal grounds of this challenge and the timing thereof.
Great. Thank you very much. And good evening to your viewers. So firstly, HFA represents 20 medical schemes and 3 administrators and approximately 4.1 million lives. So it's about 46% of the medical schemes lives. So we've actually been throughout this time, while the NHI Act was only signed about a year ago, we've actively been engaged, in making submissions to both Parliament, requesting engagements with President, as well as Minister of Health, to show our concerns regarding the NHI Act, what the downside risks are. Unfortunately, that hasn't come to fruition. So we've had to, take a more legalistic route. It's not our preferred route. We obviously want to actually go a more supportive route. But given the economic consequences and what we're seeing, we have to actually now turn to the courts and hope the courts will actually seek clarity. So there's a number of reasons. We want, firstly, find that the Act actually is irrational, that's not able to actually achieve its intended purpose. 2, that it actually entrenches single fund model, which means the role of medical schemes will be relegated to complementary codes. So it actually infringes the rights to access healthcare. And 3, it's actually not a progressive measure of advancing healthcare. Now, for example, some of the things, and you've already alluded to it, comprehensive care, which is the equivalent of what NHI and government has promised, is that the level of care that all 61 million people will experience is equivalent to what medical scheme cover is today. But to realize that, you'd actually have to, as you mentioned, personal income tax. Those people that are paying personal income tax would have to pay 2 times what they're currently paying today. And that is across the board on average, right? But on top of that, just to maybe explain, what this means, you'll actually be experiencing less take-home pay. So somebody who earns, for average, 92,000 Rand a year, would generally be a low to middle income, there's about 3 million of those taxpayers. They currently pay 18% tax rate. After NHI is implemented, they'd be expected to be paying 41% tax rate. And that means if you're on a medical scheme, you're 92,000 Rand, you'd still have to pay, you'd come home with 10,000 Rand less. And for those that are not on medical schemes, they're actually impacted more. So a 92,000 Rand person earning, they would be left with 20,000 Rand less information. So across the spectrum, across all income spectrums, we see members will experience, not members, South African taxpayers will experience a decline in take-home pay between 12% to 36%. So it's basically 1 paycheck to 3 paychecks.
Those consequences are an eye-opener, but I'm also interested in whether you have confidence in this case getting to a point of victory and what type of backing you have, particularly on the side of medical aid schemes.
Sure. So we are going the legalistic route, right? Now, the legal route will mean it'll probably take 5 years to get to the Constitutional Court, because that's where it's headed. Now, my issue and concern is we have the support of the 4.1 million members and our 20 medical schemes to take the old route. But my concern and issue isn't actually about the legal route. It is 5 years of lost opportunity, which we could actually be sitting down with all the stakeholders, including government, and saying, let us build a better healthcare system for the country, one that can we all afford. And in fact, that's exactly what HFA has come to the table with. We're not just critiquing what the NHI Act is. We actually came with a proposal that is able to take us to universal healthcare that is affordable and that can actually be scaled with the economy and, as jobs grow. So we've actually put forward what we call a hybrid multi-fund model. And we just we want to hope that we can get all the stakeholders around the table. That's the hospital groups, the doctors, and including government, to figure out what is the right model for South Africa. Because South Africa actually needs healthcare reform for every single one of our 61 million South African citizens.
Thank you so much for your time.